Good morning, everyone, and welcome to the Royal Flying Doctor Services Southeastern Section Year in Review virtual event for 2021. Thank you for joining us. Thank you for taking time out of your busy schedules. And wow, what a year it's been, and how appropriate that we all are catching up together virtually after a year of lockdowns and border closures. This session will be recorded for the benefit of our employees that can't join us this morning. But before we get into the program that's been put together for you today, I'd like to introduce and welcome one of the Southeast Section's Indigenous employees, Natalie Bates, to deliver an acknowledgement to country. Good morning, Natalie, and welcome.
Good morning. Thank you all for joining us today. My name is Natalie Bates. I'm a Barkindji Willakali Nungu. Nungu in Barkindji language means woman. I am an Aboriginal health practitioner working for RFDS Southeastern Section based in Broken Hill. I specialise in maternal and infant health and also work in general health, delivering care to Aboriginal and non-Aboriginal clients. I'm currently working on a model of care for maternal and infant health program, which will ensure a continuity of care for pregnant Nungus and their babies. In the past couple of months, I've been working in the COVID clinics alongside our doctors and nurses in Menindee. This has been really good because it has offered support for both staff and community. Thanks for listening. I'm now going to do my acknowledgement. I would like to acknowledge the Willakali and Barkindji Nation and also the other tribes that we work and live among. I'd like to pay my respects to our elders past, present, and also our young generation emerging. I would also like to acknowledge all who are joining us today, both Aboriginal and non-Aboriginal people. Could we please take a minute of silence to respect our elders that have passed and all others that we have lost in our families. Thank you, everyone. I hope 2021 Year in Review goes well.
Thank you, Natalie. Appreciate that. So my name is Glenn Toddhunter. I have the great pleasure and privilege of being your MC and host for this year's Year in Review virtual event. And again, thank you everybody for taking time out of your busy schedules to join us and to hear about what has been an incredible year. It has been incredibly challenging and busy for those of us in the Southeastern Section, and we look forward to sharing that with you. Thanks to our communications team for putting a great program together. I'm currently the head of flight training for the aviation training team based out of Dubbo. I've been with the Southeast Section since 2013, initially as a line pilot flying out of our Launceston base, servicing our Tasmanian community and working with Ambulance Tasmania. But then more recently, I'm very fortunate to be able to start a new training organisation for the Southeastern with our own aviation training precinct and our flight simulator. And here at Southeast Section, we're very proud of that because we're the only section in the RFDS Federation that has its own aviation training facility and simulator, which has already paid itself dividend. The COVID response, which is ongoing, has posed many challenges to the aviation training team and the flight operations teams, one of which has been the cross-border travel for our pilots who are required to undertake regular training, and a lot of which is conducted up here on the Sunshine Coast at Maroochydore at the airport using a King Air simulator. So that's posed many great challenges. And our simulator based in Dubbo has allowed us the flexibility to redirect that training in our own facility and be able to conduct that compliance training and checking keep our pilots flying at the high standard that we all work to maintain. So the Southeast section is very, very fortunate. We're very proud of that facility, and it's served us very well during the COVID response. So it's great that no matter where you are, that you can join us today in this virtual capacity. So I hope you've got a cup of tea in hand and ready to enjoy a great program so we can share the highlights of the last 12 months of the year that was 2020-2021. Today, we'll be hearing from our board president, Alex Scomps. We'll also be hearing from our Chief Executive Officer, Mr. Greg Sam, as well as some insights into our health service activities over the past year, defined as it was by the impact of COVID. While these activities have certainly kept us very, very busy, of course, our delivery of primary health and clinical services has continued alongside of our COVID response, which has posed even greater challenges and kept our team even busier during this year. So it's entirely appropriate, and particularly it's great we have an opportunity in this virtual sense to share with all of our many great supporters that make it possible for us here at the RFDS Southeastern section to do the work that we do servicing our communities, to share with you some highlights during that year. So we hope you enjoy the program that's been put together to highlight that today. And to start things off, I would like to welcome and introduce our RFDS Southeastern section board president, Mr. Alex Scomps. I have the great pleasure of working with Alex regularly through our board aviation committee. Good morning, Alex, and welcome.
And there we go. Good morning, Glenn, and thank you very much for your introduction. And also thank you, Natalie, for presenting the acknowledgement of country. Thank you. That was most welcome, and a very well job done to you both. Thank you. Welcome everybody to the 2020-21 year in review for the Royal Flying Doctor Service South Eastern section. Today is obviously a very important occasion, and while we're moving quickly towards being able to meet in person, as we've done in previous years, I am thankful that we can still celebrate the achievements of our supporters, staff and services, albeit virtually. I'd like to start off by expressing my severe thanks to all employees of the Royal Flying Doctor Service South East section. Thank you. In what has been truly an uncertain and challenging time for all of us, you have remained resilient throughout, and you continue to show your dedication and commitment to providing our communities with access to a multitude of healthcare services. In this period, the Flying Doctor pivoted to include new services and programs that support our communities, all while delivering primary healthcare and emergency retrievals. I'll touch more on that later, but now I want to share with you two services that have been particularly pivoted during this period. A key factor which has evolved throughout the year has been the Southeast section's ability to maintain our emergency and primary health services while providing a major number of respiratory clinics and COVID vaccination clinics. What you may have seen in the media were stories and interviews from our teams conducting vaccinations at cities and towns right across New South Wales. These were conducted in clinics, community halls and fields, and as well as more unusual locations such as shearing sheds. But what many of you may not be aware is this meant long days, weekend work and time away from family. Employees transitioned from their normal roles to support our frontline teams, and those who continued to work in their normal roles kept the organisation functioning, ensuring that the Southeastern section continued providing life-saving emergency evacuations and comprehensive programs and services. But what everyone can see is that these efforts have made a genuine difference to the lives of so many people. In early 2020, when the pandemic first hit, the mental health, alcohol and other drugs team quickly moved to online and phone consultations rather than face-to-face, so they continue providing direct clinical services to those living in remote locations. As you're all aware, mental health and wellbeing has become a much more widely talked about topic over the last 20 years or so, and with the team successfully being able to reach people, it has ensured that that stigma is changing and that people are receiving this important service no matter where they live. I am immensely grateful to the mental health, alcohol and other drugs team for achieving this. Well done. These are just two ways of many of our organisation going above and beyond to serve our communities. Thank you to everyone at the Southeastern section for your efforts, no matter your location, the role you played or continue to play. It is all counted. We are truly grateful, and because of this, a total of 27,500 or close to 30,000 vaccines were administered across the southeast section as of October 18. It is an amazing feat, and you should all be so proud. All the while, during this challenging time, the southeastern section has been backed by you, our hardworking and passionate supporters. It is because of you that the Flying Doctor remains in the air and on the ground, delivering vital primary and emergency health care to outback communities right across the region. Thank you to all our supporters for your dedication and commitment throughout the year, especially the Broken Hill Women's Auxiliary, the Dubbo Support Group, the Outback Car Trek, the RFDS Friends in the UK, the Silver City Treadlers, the Lightning Ridge Support Group, Bright Smiles Charity Ride, and Tomra Return and Earn. Thank you. All our valued supporters have been with us every step of the way during this often unprecedented year. We appreciate your time, efforts and dedication. Even though the global pandemic meant many of our fundraisers were not able to take place over the 2020 to 21 period, your continued backing means that we can see a light at the end of the tunnel, and we hope to mark the fundraising events on our calendars again soon and travel to those communities that we hold so dear. Thank you to our communities for always having faith in us. The Flying Doctor continues to be shown a tremendous amount of support from the communities in which we service, and because of their faith, confidence and belief, the southeastern section remains a trusted healthcare provider. This has been especially seen at our COVID clinics as teams travel to new locations supporting communities we may not otherwise ever have reached. From all reports, these communities have been so appreciative of us being there, and our bases were presented with such kind and generous donations of thanks. We're also humbled for this, but really it is you who we must thank. So, from behalf of everyone within the southeastern section, thank you for having faith in us and for allowing us to support you in your time of need. As I've mentioned, it is impossible to speak about the challenges, complexities or successes of the last year without mentioning COVID. Regardless of where you're watching from today, like me, you too would have been impacted by the pandemic in some way. For the southeastern section, it required all of us to use our flexibility and adaptability to ensure we continued providing primary healthcare and emergency retrieval, while also delivering respiratory clinics and more recently, our vaccination clinics. We met this challenge head on and has allowed us to play a crucial role in the vaccination rollout across regional and remote Australia. Of course, none of this would have been possible without the assistance and collaboration with our partners right across the southeastern footprint. From local health districts, Aboriginal health and service providers, and other primary healthcare networks, there has been a united approach to combating the pandemic, ensuring that our communities are safer and vaccination rates are some of the highest in the country. During the year, the board strategic planning session brought the board together to draw on insights from our regions on the health needs today and into the future, and to build on our existing strategic approach to healthcare delivery. A vital part of this is understanding the needs of our communities, anticipating what will be needed in the future, and building the requisite capabilities in our operations, aviation fleet, workforce, quality and safety constructs, funding, and contracted service opportunities. In 2020 to 21, we put our resolute commitment to building our organisation through a health service model into action, shaping the structure of our workforce and operations to strengthen this proposition. Uncompromising in our focus on patient care and a quality and safety framework, the structure features a health service manager position to lead our operational activities from both our Broken Hill and Dubbo bases, and the launch of our 24/7 operations centre to ensure agile, around-the-clock delivery of our service across the network. Whilst located in Dubbo, the centre controls the operations across the entirety of the southeastern section. Another exciting moment for everyone within the southeastern section this year was the launch of the RFDS television series. Filmed at our Broken Hill base with staff, planes and equipment heavily involved, it ensured that the show was a true representation of who we are and what we do. While the show aired after the 2021 reporting year, our involvement happened a lot earlier than that. The finished product shown on Channel 7 and their streaming service 7 Plus was the result of a successful collaboration between the Flying Doctor and the show's producers. While season 1 has since wrapped up, I'm so proud of the finished product, and like many other avid fans out there, I am hopeful for future seasons. Another great milestone that we saw in 2021 was marking the 20 years of operation out of our Dubbo base. So it's only fitting that we recognise the efforts of Terry Clark, retired President of the Dubbo Support Group and former member of our board. Thank you, Terry. Terry's contribution to the growth of the Royal Flying Doctor Service in the Dubbo region has been exceptional, and today I want to recognise his energy and his loyalty to the service over the years. During his time as President of the Dubbo Support Group, Terry, like all the valued volunteers of the group, have been passionate advocates of the Flying Doctor in the Dubbo region. It is because of Terry and the Dubbo Support Group's fundraising efforts that a significant contribution to the development of the Visitor Experience Centre was made possible. Thank you, Terry, not only for your dedication to enliven the Dubbo base, but for your championing of the Flying Doctor. In closing, I want to thank you all for being a part of today's celebrations. I hope soon very much that we can meet again in person. But right now, let's all enjoy the successes over the year over Zoom. I'll hand back now to Glenn with more of the year's highlights. Thank you.
Thank you, Alex. Appreciate those insights. Now I'd like to introduce a great supporter and the patron of our organisation, the Governor of New South Wales, Her Excellency, the Honourable Margaret Beazley, who has pre-recorded this message for us today. Thank you, Your Excellency.
Pujiri Gamarua, Dian Babana Gamarada, Gadigal Nagara. In the language of the Gadigal, the traditional owners of this land on which I stand, I convey my greetings to the Royal Flying Doctor Service Southeastern, and I pay my respect to traditional owners of all the lands across which the service works and travels. They say, you know, you've become famous when you're the subject of a TV series. In the case of the Royal Flying Doctor Service, with over 90 plus years of service to people who live, work and travel in rural and remote areas, you were already famous. Nonetheless, the screening of RFDS has showcased the importance of your work and has brought it into the homes of all of us. And as we know, you're the real stars. This past year, the Royal Flying Doctor Service Southeastern has maintained the critical work of primary health care and emergency retrieval services with the added responsibility of attending to the health needs of isolated and remote communities in a pandemic, effectively which has doubled your health service delivery. Just recently, you've hit an incredible mark of 30,000 vaccines administered through Southeastern clinics and pop-up clinics, including in shearing sheds, paddocks, hotels and sporting ovals. Congratulations, what an amazing effort. Earlier this year, Dennis and I were privileged to gain insights into the critical work of the Flying Doctor during our visits to clinics in White Cliffs and in Laos. The value that small and remote communities place on the on-the-ground medical and telehealth consultations and the absolute reliance on GP, dental, maternity, early intervention and mental health services by each of the people we met during our visits was just so plain to see. In our visit to Laos in mid-June, just before the lockdown here in Greater Sydney, we were fortunate to see RFDS's brand new clinic, generously funded by a donor and its operation supported by local volunteers. That visit was prior to the spread of the Delta variant through Western New South Wales, which further isolated communities through limiting people's travel. We've now been updated on how communities, including vulnerable Indigenous communities, have adapted to COVID-19 and on the operations of Southeastern vaccination and respiratory clinics through meeting recently virtually with your Chief Executive Officer, Greg Sam, and General Manager Jenny Beach just a few weeks ago. The story they told us was one of passion, dedication, adaptability and hard work, 24/7. Dennis and I acknowledge the generous donors and the supporters of Southeastern Section and the critical role they play behind the scenes in keeping Royal Flying Doctor Service going, both in the air and on the ground. This past year has been challenging and, with the continuing workload of the pandemic, deeply exhausting. Yet, as we know, at all times, the Royal Flying Doctor's connection with rural and remote communities is a lifeline. As patrons, a heartfelt thank you from us and from the communities that you care for in ensuring that access to the finest healthcare is everyone's right, no matter where they live.
Thank you, Your Excellency, and we here at the Southeast certainly appreciate. Thank you, Your Excellency. We certainly appreciate your ongoing support. I had the great pleasure of meeting Her Excellency when she commissioned the new Dubbo Aeromedical and Aviation Training Facility in Dubbo in 2021. So thank you for your ongoing support of the RFDS Southeastern section. Next, we'd like to share with you a story of one of the New South Wales residents, Hamish Noble, hailing from Mudgee. Earlier this year, Hamish and a bunch of his friends had organised a trip of a lifetime on motorcycles touring through central and far western New South Wales. But unfortunately, during that trip, Hamish suffered a serious accident. So what we'd like to share with you now is a video of Hamish's story. We hope you enjoy it.
The plan was to head from Mudgee out to Cameron's Corner, just a 4 or 5 day ride. Get out of town for a little bit, get out to the outback, which we all thoroughly enjoyed out there. It was a beautiful day, perfect riding. We got to Waneering, our first fuel stop, had a bit of a snack, topped up the tanks, and then headed out on the Cutline Road, heading towards Broken Hill direction. Coming over a cattle grid, then coming up a sweeping right-hand crest bend. The back end of the bike slipped off the outside camber on the loose gravel, so I lost traction and control of the back end of the bike. The front tyre dug into the ground and the bike cartwheeled. So all you see is sky dirt, sky dirt. Been thrown off the bike and sort of landed head first on my shoulder. A lot of pain in my chest, and especially down my left-hand side. The boxes come up and hit me in sort of the back side of my ribs. Well, when I was lying there, I sort of got myself up onto my hands and knees, just trying to get my breath back. Didn't lose consciousness or anything like that. Two ex-military guys actually, they pulled up with a satellite phone and they were absolutely fantastic and make the calls and coordinate essentially what to be an RFDS rescue.
Royal Flying Doctor Service, Broken Hill.
Hello, Randall Greenberg. I had a talk to the doctor at Broken Hill. I advised that they should just drive him straight to Anara, and what I thought he needed most was to get to definitive care if he's got a major injury. We got in the plane and went to Anaring.
The two guys we're referring to, the Good Samaritans, so Scott Petrie and Simon Buckpitt, they tried to get me out of the car. Yeah, so the adrenaline wore off by then, and that was sort of when the pain hit and almost passed out.
I put an IV in and gave him some pain relief. I had to give him quite a lot of pain relief. He was in a lot of pain. He said he was having trouble breathing. I then got an ultrasound, a bit worried that he might have a punctured lung. I was a bit concerned about a ruptured spleen, and it can bleed a lot. so it can potentially be fatal.
They coordinated and got me back to Dubbo because we were closer to home. Straight into the ambulance and then into the hospital, and then that's when all the assessments started from there.
He then had a CT scan which showed multiple fractured ribs and a small hemothorax, which is a bit of blood in the lung. Quite a lot of fractured ribs. No ruptured spleen, thankfully. So yeah, he's lucky to get away with broken ribs, which will heal ultimately.
So I was in hospital for about 7 days. There's still a slight bit of pain, and I can still feel the movement there, but yeah, I won't be on a bike for another couple of weeks. Look, I can't thank them enough. I've got a small family, little boy and little girl.
This was just us doing our core job, is what we do. We go and help people in remote places that are ill or injured.
They brought me home for my family, and as I've said before to anyone who asks, I view them as the angels of the sky.
Wow, great story. And it's always fantastic. It's always fantastic to see the human side of those stories and hear from people firsthand that are recipients of the service that RFDS and the Southeastern Section provide on a regular basis. And you're in good hands when you see our Chief Medical Officer, Dr. Randall Greenberg, turn up. I understand that Hamish has made a full recovery, and I'm pleased to hear that he's fully fit and able to ride again. So great story of Hamish. So now I'd like to introduce to you our Chief Executive Officer, Mr. Greg Sam. Greg will share with us a few words of his thoughts and insights from the past 12 months. Good morning, Greg, and welcome.
G'day, Glenn. Good morning, everyone, and thank you for joining us today. And let me also acknowledge the traditional owners of the lands on and from which we meet today, and pay my respects to elders past, present, and emerging, and also thank Natalie for such a meaningful welcome to country. This event traditionally was an opportunity for us to recognise the work of the service through the preceding year, but it was also a physical opportunity to allow our supporters, our volunteers and donors to come together with staff to sort of celebrate the preceding year. And as with last year, I think we're certainly feeling that distance at this time. And it's great to see that so many people are participating today in the online environment. And as I said earlier at the AGM, I think we're all, well, some of us, should I say, are a little more experienced with dealing with this technology. But I think you should feel very much part of that broader RFDS community and family, no matter where you fit. And I think it's really valuable to be able to open up the access for so many more people under this format. So thank you. My role really is not to provide you with a long, boring speech. And I remember not long after I started in this role and went to meet with a few locals around some clinic services. And in the group, someone asked me what I knew about John Flynn. And I said, well, from what I've read, he could talk passionately for a long time. And someone said, well, that doesn't mean you have to, does it? And I said, no. And from then on, I've appreciated trying to keep my speeches to an absolute minimum. But generally, when I talk about the year in review, I try to centre it around a theme, and normally those themes speak to our values of care, reliability, safety, and trust. And what you will hear through today and what has already been highlighted, I think, is the focus around the service's ability to adapt through the last 12 months. And I think that when we were speaking this time last year, where we sat in terms of the COVID pandemic then, was really looking towards an outlook of less restriction and awaiting the introduction of the vaccine and vaccination programs. And to some degree, I think the last 12 months has shown us that we've been characterised now by the emergence of the Delta strain and its impact nationally and at state level, but importantly in rural New South Wales and particularly in Western and far Western New South Wales. And we've seen the need for us as a service to have to continue on our primary objectives in responding to COVID, which was to keep our staff safe and well and to maintain the optimum level of service that we could continue to provide as usual, given the multitude of restrictions that existed across the country, and recognising that we operate across a number of borders, but also reflecting on the fact that our ability to provide our service depends very heavily on being able to be mobile, both in terms of moving patients around, but importantly, moving staff and having access to staff. And finally, it was always a priority for us and the board to make sure that the potential economic and financial impacts of COVID on the service enabled us to continue to meet our objectives, to grow the service and manage all the inherent risks that we were facing. But also this year, with the advent of Delta and the incursion of the virus into community, where we saw so many clusters and outbreaks, we also needed to very quickly be able to build our capacity to surge and develop new service models very, very quickly in our area of medical, retrieval, patient transport, primary healthcare and community-based services. And we also needed to very rapidly enhance and expand those COVID-specific services that we'd started over 12 months ago, which really began with technology-led screening and testing and the application of infection control and broader public health control measures through to the advance in testing and screening technology and importantly, vaccination. So for the service to do that whilst the virus raged across our footprint is a testament to so many staff, so many of our communities and supporters who were able to step up to enable us to meet that challenge. But in adapting to that, we also very quickly had to become collaborators and partners in delivering a broader, coordinated and integrated national, statewide and local response. We were dealing with 3 levels of government and trying to still work within local coordination of responses. And our panel that you will hear from shortly will detail that in much better ways than me. And I think also I commend the year in review document to go through some of those specific initiatives that we were able to undertake. To contextualise this, the outcomes and the values that we were able to deliver to communities through the preceding 12 months amounted to almost 60,000 occasions of care. Almost 9,000 patients experienced a medical transfer or retrieval in one of our aircraft. Our dental teams provided almost 5,000 occasions of service. Our mental health and alcohol and other drug teams provided over 6,500 consultations across multiple sites. And you've heard already from Alex, and I'm sure you will hear later, about the mobilisation of the mental health and wellness response from COVID very early on. It preceded almost every other service that we were able to provide and continues at a pace currently. And you will hear explicitly around our vaccination initiative that's been operating at a level that we could not even predict or anticipate 6 months ago. But now we are very much part of that front line of vaccination effort across the state. Our health services and operations have been exemplary. And I also want to recognise the contribution and commitment of all staff, all volunteers at and from our bases and locations, whether it's Broken Hill, Dubbo, our Northwest clinics, Mascot, Launceston, Essendon, Bankstown, and our corporate office in Elizabeth Street. The entire organisation has enabled this level of performance whilst managing the daily impact of COVID on their own professional and personal lives, week in and week out. And it's fair to say that different parts of the business were experiencing very different restrictions, and being able to coordinate that across the entire organisation has been a major challenge, but one that we've been able to rise to. Our tourism staff and volunteers who have so competently set up, packed up, set up, packed up, and been able to manage the visitor centres so well, to keep visitors safe and to keep our staff safe and to keep our bases safe. Our fundraising teams who maintain such a critical relationship with our supporters and the broader community. Our communications team who've had to manage an exponential level of public and media interest in the service throughout the years. It's been almost a 20-fold increase in direct inquiry through the service once we began vaccination in Western New South Wales. Our flight ops, engineering, base support teams across all bases who've kept the service in the air, on the road and online. Our finance, IT, people and culture and admin teams who have so competently supported and managed so many of our staff needing to work flexibly. Given the many challenges, we asked a lot from each of our staff, and we sought to garner as much support as we could from our service communities, and all have delivered to this ask. In doing so, we've also formed new relationships across the service and sectors and strengthened many existing ones. As Alex had also highlighted, I would quickly mention the milestones at Broken Hill and Dubbo in terms of us being able to work to quickly stand up the production and ultimate screening of the RFDS series. And keep in mind that the preparation and filming at Broken Hill Base occurred through these very uncertain windows of COVID access. And it's a testament to the Broken Hill and broader community, and particularly our staff, that we were able to support that and bring it to eventuation. And also the 20th anniversary of the Dubbo base. This is a fantastic milestone for the service and the region. It's a testament to those who had the foresight to see the opportunity and the value to Western New South Wales communities. And my thanks and acknowledgement to the many staff, volunteers and supporters in enabling the service to develop to the multi-purpose facility that it is today. So on to more thank yous. We are deeply grateful to our many dedicated and generous supporters and volunteers who donate their time, resources and goodwill as contribution to the provision of our service. My thanks to our patrons, Her Excellency, the Honourable Margaret Beasley and Mr. Dennis Wilson, for their incredible commitment and passion as our patrons, as you heard from Her Excellency's presentation. My thanks to the Board of Directors who volunteer their time, volunteer their wisdom and support, and are always the strongest advocates for our service continuing to serve remote and rural communities as its priority. My thanks to our partners, the Commonwealth, state and local government agencies that support us, the Western New South Wales, Far Western New South Wales local health districts, Western New South Wales Primary Health Unit, New South Wales Health Share, Ambulance New South Wales, Ambulance Tasmania, Broken Hill and Dubbo Regional Councils, and the many local service partners. To all our supporters and volunteers and donors, we share the disappointment of the deferrals, delays and cancellations due to the required restrictions and appreciate the effort in maintaining your support for us in any way possible. To the Broken Hill Women's Auxiliary, the Dubbo Support Group, Silver City Treadlers, Lightning Ridge Support Group, the Outback Car Trek, Bright Smiles Charity Ride, Outback Air Race, the Outback Morning Tea, Toma Return and Earn, and Cairns Super IGA. Thank you for hanging with us and being such a vital part of our service. Please know that each of your efforts are seen, experienced and appreciated. They make a vital difference to the lives of those in rural and remote communities. To my RFDS colleagues around Australia, my thanks also in continuing to deliver on John Flynn's vision. To the exec team, my acknowledgement of the effort of working at extraordinary levels throughout the year. And I would like within that to recognise the retirement of two outstanding and long-standing members of the RFDS South Eastern Section team. Firstly, David Lang, who retired this year after 22 years as an absolute stalwart in our engineering and flight ops team at Essendon. And Peter Miranda, who many of you know, who recently retired after almost 13 years as General Manager Corporate Service and one of the strongest advocates that Broken Hill has ever had. Both Peter and David are exemplars of our values and commitment to service. And finally, my personal and heartfelt thanks to every member of the RFDS staff who have shone wonderfully to the demands and duress of the last year. There have been so many of our staff who've worked selflessly to provide that mantle of safety in so many communities, and you will meet more of them today. It is truly a workforce that we can all be rightly proud of. Thank you. Thanks, Glenn.
Thank you, Greg. Thank you, Greg, for those words, and also thank you too for your leadership during a particularly challenging year. We appreciate hearing from you. And following on from, sharing the impact of COVID, from clinics in large towns to shearing sheds in the far corners, dedicated RFDS South Eastern staff have been ensuring that vaccination rates in Western, Far West New South Wales continues to rise, as well as looking after communities in the traditional area of Western Far West New South Wales. RFDS has begun conducting pop-up clinics in the Upper Hunter, New England and Jervis Bay regions. Our teams have been fantastic. They've been tireless, and we've had great support from local health authorities and services. This is a vital service for our communities, as Greg has just said, who may have otherwise had limited access to the vaccine. Ultimately, these services keep people healthy and out of our aircraft and out of hospitals. So we appreciate the support of everybody involved. We'd now like to share with you some vision of a part of our COVID response this year. We hope you enjoy.
So we actually started with the vaccination rollout back at the end of June. There were communities out there who jumped on board very, very quickly.
It's like a responsibility to myself as well as to the community, and I don't want to be the one to be putting someone else's life at risk.
There were other communities where there definitely was some hesitancy.
Are we just guinea pigs? Work brought in the law that you have to get double vaxxed if you want to work there in any retail store, so I didn't really want to get it.
And so in the early days, some of the time was spent talking to people, answering their questions, educating them, and gradually bringing them on board so they could make the choice.
I sat on the fence for a while. I realistically just thought about it, kept putting it off, and then realised that I used to get the flu shots every year. What's the difference? So I decided just come and get it done.
We've gone into lots and lots of communities alongside the Aboriginal Health and Medical Services. We've worked with them to try and find the people that need to be vaccinated, and that's been quite an incredible partnership.
Your mother, the age she's at, the community, my people, our town, everything just in general, there to be safe.
We've been taking teams out of Dubbo and out of Broken Hill going out to remote places. They spend the day or 3 days or a week in that community, and then they'll come back into base. They do the first round of vaccinations, and 3 weeks later they go back and they offer the second vaccinations. So we'd worked through a lot of that far west, and then we've come into more of the northwest of the state, and we're doing lots of clinics.
We're in the middle of what they call the Golden Triangle, and it's a massive cropping area, and it's ag, so everything around here is to do with agriculture and grain, cattle, everything, yeah.
We're part of an immunisation team. People have come out of retirement to join the team. Everyone has a sense that they want to help out.
And I retired just before COVID started.
I felt like I didn't need to be sitting at home on long service leave.
But I did feel really guilty that my colleagues were still there preparing for COVID.
People come in from out of town, you know, they drive in 60, 80 k's sometimes to be vaccinated.
We woke up around 8 o'clock, and that was our first plan today, to have our second dose done.
The pop-up clinics have made a huge difference to the availability of getting the jab here in Moree.
You know, a lot of us country blokes don't like doctors, so something like this is a bit easier.
So we get everyone to form a line in a COVID-safe fashion, and they come through. They get processed digitally, and we create a data for every person. They then come through and they see one of our immunisers. They get immunised. They wait for 15 minutes to make sure everything's fine, and then they go home.
In my workplace, we need to get double vaccinated in order to be rostered.
Just to be safe and keep my family safe as well. And I'm also vulnerable.
So I can keep working, and besides, we've got a funeral next week. That's one of the reasons as well.
Day one in Moree, great response. We were busy all day. 324 locals were vaccinated. Probably up to 25% of the people coming are first dose. Well, we're headed to North Star and Bingra and Warrior Elders. So, yep, we've done that circuit before, so we're all doing second doses for those same clinics now.
It was convenient to be able to get my second jab here today, so I can, live my life like normal.
Well, I was going to get it because I'd rather have the vaccination and deal with the side effects of that than get the virus, and who knows what it does in 10 years.
And hopefully if we catch it, we don't die from it. You know? That'd be something handy.
We're really proud of what the RFDS is doing, and the opportunity to put the RFDS logo on our shirt is quite special, I think.
I do know here in southeastern though we're well over 15,000 now, which is huge, and we've done more since then. Nationally, at this point, the Royal Flying Doctors have done about 30,000, so that's all the sections put together, and we're still out there, and we will be out there until we've offered the vaccinations to everybody, first and second doses to everybody that needs it.
Well, it was fantastic to see some of the great work done by the teams across, and I can only echo and pass on, appreciation to the dedication, the professionalism, and the hard work of staff that have risen above and beyond the call to, get out to those communities and get those vaccination clinics going. So I hope you enjoyed seeing some vision of that. So what we have next for you is to hear more about what that the impact and what it meant for the rollout of those clinics across the Northwest. We've today got a panel of people that have come together, and we thank them for their time, and I have the great pleasure of introducing them to you now. And I've got some questions from, we'll be having a Q&A session to ask them about what their experience was like during their participation during the rollout. The first of our panelists I'd like to introduce and welcome is Ms. Belinda Gentle, a primary health nurse, Dr. Randall Greenberg, our Chief Medical Officer, Ms. Kellyanne Johnson, our Health Quality and Safety Officer. I'd like to welcome Ms. Jenny Beach, General Manager, Health Service, and also like to welcome Professor David Lyle, RFDS Southeastern Board Member and Public Health Controller overseeing the public health response in the Far West. So the first of the questions I have is for our Chief Medical Officer, Dr. Greenberg. Randall, we know that you've seen firsthand the impact COVID has had on patients. Can you please give us and those viewing us today, our supporters, insight into how devastating this virus can actually be?
Yeah, thanks, Glenn. So in the last few months, I've been looking after patients with COVID at Dubbo Hospital. And I think before that, I mean, I'd seen footage overseas of doctors working hard and critically ill patients, but I never really appreciated it until I had to experience it, really. I mean, it's a strange virus. I mean, as most of you know, some people can be asymptomatic, just have no symptoms, don't even know they've got it. Yet the people that I was looking after were critically ill, and they were some of the sickest patients I've ever looked after. I mean, when it first hit, it was a bit of a steep learning curve for us because we'd looked after a few last year, but things had changed a lot. I mean, we do have treatments now, which we didn't really have last time. So it's a really complex and complicated virus. It fills the lungs with inflammatory material, and it's sort of fluid that just fills the lungs. Really difficult to ventilate, and the thing about it also is that we have to ventilate them for like several weeks often, which has a big impact on the whole health service. Seems to affect all the other organs, particularly kidneys. A lot of ours ended up having to be on dialysis, and a lot of them end up having multi-organ failure and unfortunately sometimes death. You can't underestimate what it's like working in the PPE, the personal protection equipment, all the time. It's uncomfortable. You can't see people's faces. You hard having difficult conversations. You can't hear very well, and that's particularly true with when we do our retrievals. You're often in that plane for a long time, and so you've got this equipment on. The mask, the N95 masks, they're very tight fitting, and they get quite painful after several hours having them on. And the other part of it is we can't underestimate how we've just had to reorganise everything. So we had to reorganise. Dubbo Hospital was completely reorganised. All the teams were reorganised, physically reorganised, and that. I've got to say, Dubbo Hospital did a particularly good job of reorganising and making it so that you have to have hot and cold zones so everyone's protected, but you've got the ability to look after critically ill patients. And we had to reorganise, RFDS had to reorganise decontamination zones. So we had to physically reorganise our bases as well as reorganising a lot of the way that we do things. I think sort of they're the main things I'd want to talk about, really.
Thank you, Randall. I appreciate those insights, and I'm sure all of our supporters and those joining us today will have enjoyed them as well. My next question goes out to our General Manager Health Service, Jenny Beach. Jenny, how did the RFDS become involved in the vaccination rollout? I imagine this presented a whole set of challenges that weren't anticipated prior to the virus emerging in our communities. Can you tell us and those joining us today about how the plan was developed and delivered?
Yes, I can. When we go back to where we started, which I go back always to the beginning of last year when we started to test and we heard about the pandemic. So I think probably the key for, the RFDS is that our work is about rural and remote communities and caring for people throughout life. Now, that is a natural progression, really, when there's something like a pandemic going on, that we would step in and we would go out again to look after those communities. We've heard it mentioned before, but the RFDS response is a national response as well. So, yes, we've got our Southeast section response, which we've been heavily involved in, but then it's going right across the country. And I think we've seen the sort of stats flying around when we recorded those initial stats. They've almost doubled since then. And the stats we got last night are that we nationally, it's over 59,000 vaccinations have been given, and in Southeast section, it's just under 30,000 last night, and I'm sure they'll get up to 30,000 today at some stage. So it's a huge response. I know when they started to talk about us doing the vaccinating, they mentioned 80,000 across the whole country. So I think you can say that we'll get well and truly to that point. The decision to respond is not made alone, and I think that's extremely important. We're stepping into unknown territory, but we did it with partners. And in the Far West, we worked so closely from the beginning of last year with the local health district and with Marama. And so our response was always a combined sort of response. We had surge plans and things that we developed, but again, we were planning for something that we hadn't actually done before. So that in itself is quite challenging. And then you step out to do some of this, which we haven't done before. And I think you do meet challenges along the way, but part of what has happened is that we've learned, we've developed, we've improved our systems all the way through this. And the numbers that we've actually vaccinated now are incredible. One of the keys, I think, with this is really relying on and working with your partners. So it's not just the local health districts. There were land councils, there were local members, there were universities. There's a range of people that we've worked alongside, and that has helped us to kind of overcome the challenges. I think that joint planning and the surge plans were incredibly important. We started out of Broken Hill with a kind of a controlled service plan, and we thought, right, we can go out. We started to vaccinate 24 people in a day. That grew to 50 or 60 with a team of 2. And then, we started that back in June, and then we basically moved very, very quickly out of Dubbo and into that northwest area, thinking we would be doing something similar, but within days we realised we were moving into this kind of mass vaccination plan. So many, many learnings out of that as well. But the figures and what we've done to date are quite incredible, and there's a huge team behind doing that, and lots of learnings.
Thank you, Jenny. The next question I have is to Professor David Lyle. Professor Lyle, I understand you were seconded to the role of Public Health Controller overseeing the public health response to the COVID outbreak in the Far West. Can you please tell us and those joining us today a bit more about that role, how it came about and what it entailed, please?
Yeah, sure. Thanks, Glenn. Yeah, I'm a public health physician and head of the Broken Hill University Department of Rural Health, as well as being an RFDS board member. So 10 weeks ago, I was seconded to be the Public Health Controller as part of the Far West Emergency Management Plan. This was organised particularly in response to the COVID outbreak in Wilcannia. Up until then, the Public Health Controller was based in Dubbo, However, with multiple outbreaks across Western New South Wales, the Ministry of Health approached me to join the team in Broken Hill so we could focus on supporting Far West New South Wales. As the controller, I coordinate the public health response to COVID. Working out of the local health district, this is done in collaboration with other government and non-government agencies, including the RFDS. Public health is engaged in what we call TTIQ, test, trace, isolate and quarantine. Our job is to identify COVID cases through testing and control the spread of the outbreak, isolating cases and tracing and quarantining close contacts. Some of the people here today may have actually been touched by this process already. We also provide public health advice and about the epidemic and support the vaccination effort across the district. And I can tell you it's been quite a challenging and rewarding role. Thanks.
Thank you, David. I appreciate that. Next question is to Belinda Gentle, one of our primary health nurses. Belinda, I imagine that you must have had a lot of contact with a number of people in those communities who were nervous about getting vaccinated. How did you and your team reassure people around about those vaccinations?
Well, we were lucky enough to have really good doctors with us, and we would always ask them what was making them nervous. Most of the time it was not actually the vaccine, it was just the fact that they were having a needle, like any needle. So with a lot of them, we'd have to talk through, I'd have to explain what I was going to do step by step so that they were aware of what was going to happen. I remember one in particular, she was so nervous, she waited till the very end. And I kept going out looking at her saying, are you coming in? She was no. And then I had a quiet little word to her and asked her what was going on. And she told me that she was just petrified of needles. Normally her sister has to sit on her at school to get needles. And I thought, well, we can't do that. But her husband came in with her. And again, we walked through the process. I had the doctor saying, you know, when you're ready, we can do this. In the end, she said, like, just do it. She was hugging him so tight. She didn't even realise I'd given the needle. I told her it was done. She cried, gave me a hug. And then I realised that she had a stud mark on her face from where she'd been hugging her husband so tight. She was that nervous. So, but I think if we just talk to them, ask them why they're nervous and then just reassure them, we've had really good responses.
Thank you, Belinda. It's a great response. Really appreciate that. Next to you, Kellyanne Johnson, our Health Quality and Safety Officer. We know that you're at clinics down on the South Coast of South Wales in partnership with Wreck Bay Aboriginal Community Council. Can you tell us about the uptake of the vaccine in the Indigenous communities you work with, and was it favourably received?
Thank you, Glenn. Yes, it was very well received. As Jenny said earlier, partnership approaches were really important in delivering these vaccination clinics, and that was the approach that we took with the Wreck Bay Aboriginal Community Council and the Jervis Bay Territory Department of Infrastructure, Transport, Regional Development and Community staff. Long name there. So they did all the pre-clinic work. They distributed consent forms to the community. They took bookings. We had pre-clinic meetings with them. They told the people when we were coming, who was coming. They ensured that the clinics were culturally safe and appropriate for the communities. In the pre-planning clinics, we talked about how the clinic should run, and they just took that and ran with it. So they actually did the check-ins, the screening questions of everybody that came to the clinic. They took the temperatures, put the green stickers on people, and then they ensured that nobody left until they were observed and checked off as being okay. If we had any problems with consent forms or information, then they were able to go to the community and follow up with the people about the information. I think also being an Indigenous woman and connecting back to country down there, Wreck Bay is actually the birthplace of my mother. I think that also added to some of the success and to people coming to the clinic. There was lots of talk about, you know, me being a nurse and going back down there, and I worked for the Royal Flying Doctors, and it was really good to be able to engage with people down there in that way. Having a doctor at the clinic definitely increased the confidence of the community. They were able to go and speak to the doctor about any concerns or fears that they had, and the doctor was able to provide their vaccination as well as the nurses that we had there. We were extremely welcomed by both the Jervis Bay Territory staffing and the Wreck Bay Aboriginal community staff, and also one of the community members who had vaccination owns an Indigenous business, and he showed his appreciation to our service by providing lunch to the team on one of the days. The Wreck Bay Aboriginal community is actually a private Aboriginal community, so not everybody can just rock up there, but they opened the vaccination clinic to the surrounding local communities, which increased the security and safety of the Jervis Bay Territory as a whole. So we vaccinated 12-year-olds to 86-year-olds, and approximately 50% of the people that we vaccinated were Indigenous, which was really good to see. I also participated in clinics at Galargambone, Burke and Coloranabri, which are largely Indigenous populated communities. And again, they were very well received. And again, we did some of those in partnerships with Aboriginal Medical Service and our own clinicians, so they were our own clinics. On occasions, we went to people's houses. We vaccinated the whole family in the front yard, so everyone was there, and it was quite relaxed. And I think the approach that we took made it that way. It made it quite successful.
Thank you, Kellyanne. Appreciate you sharing that, not only from a professional context, but also your own personal connection to the Wreck Bay Aboriginal community. So thank you. Back to you, Randall. I understand you were personally working up for a period of time in Wilcannia, which at the time became a real COVID hotspot. Can you tell us more about your experience working in Wilcannia? I think you're just on mute there, Randall.
Sorry about that. That's the saying of the year, isn't it? You're on mute. Yeah, so one of the things that have been talked about nationally in multiple meetings we had with other organisations throughout the country was what's going to happen if it hits an Indigenous community. And unfortunately, it happened in our patch. So we're all really worried about it, and particularly worried about critically ill patients coming into the hospital, and particularly for me, having looked after these some of the sickest patients I've looked after, there's not many facilities at Wilcannia. RFDS traditionally has looked after Wilcannia Hospital, so all of the people that present to the emergency department, we look after them either remotely or if we're there, because we do clinics 3 times a week there, and all the inpatients are admitted under us. So we're the ones that look after them either remotely or face to face. So I think we all felt a responsibility to do something in that regard. So multiple discussions. I was very glad that David Lyle was co-opted to his role, because obviously knew him very well from our dealings with RFDS and through the university. So and then talking to the LHD and the public health people, and also some colleagues in Sydney in the retrieval world, they were all saying to me, like, what are we going to do if it hits Wilcannia? And so we all developed a plan, but there was like, well, there's no doctors out there, what are we going to do? So I thought we better send some doctors, some critical care doctors out there. So I went out there for the first 5 days, and then we're out there for 2.5 weeks on. But you know, don't forget the rest of the organisation. I went out to Claudio Grasso, the general manager for operations, said, Claudio, I've got to get out to Wilcannia. He said, whatever you need, Randall, we'll organise it. So he flew me and all my retrieval equipment and a ventilator out to Wilcannia. So the first thing we do, we sort of reorganise the hospital. You have to learn about a lot of things with COVID, like airflows. So to create a hot and a cold zone, a zone where you've got to put your full PPE in, you've got to know where the air conditioning is. There's no point having a hot zone where all the air blows to the rest of the hospital. So we sorted all that out. And one of the key features of our time out there was really collaboration and partnership. We met multiple times a day with people from the LHD, public health, Marima, they were actually out there. So they were there going house to house and looking after people with COVID. So they were critical on this front. And also SHEOP, which was the State Health Emergency Operations Centre, they touched base with us once a day just to get a report to see if they needed anything. And there were also multiple services at Wilcannia. OSMAT were there when I arrived doing vaccinations. The Army and the police were there delivering food. And there was something I'd never heard of before in Australia, which is this phrase called food security. So the hospital fridge was full of these meals that have been delivered, and the hospital security guy was delivering meals too. Then there was also nurses that had come from Coffs Harbour, Newcastle, all over just to help out, which was terrific. And there's also the hospital and the home team was out there. So the local health district sent nurses to go to the home and look after people with COVID. But the incredible thing about it is we didn't have to transfer anyone because of COVID, and we had a low threshold. The threshold was if anyone needed oxygen, we would fly them out. But we didn't have to do that at all, and it still amazes me, and we still don't understand it, given that other places have had really sick people. But as I say, we're there for 2.5 weeks. I think we provided a lot of support, but fortunately didn't have to deal with any crook patients.
Thank you, Randall. Conscious of time, we've got time for 2 more questions. The next one, I'll go to you, Professor Lyle. And in line with that Wilcannia outbreak, which was widely reported in the media, could you please explain how the outbreak began, how it spread, the response, and what the situation is now?
Sure, and Randall's touched on a few of those points as well. So the Wilcannia outbreak resulted from the spread of an infection at a funeral just prior to the introduction of stay-at-home orders in far west New South Wales. It spread rapidly and peaked in weeks 2 and 3, followed by a gradual decline in numbers over the next 5 weeks. The outbreak was actually over after 8 weeks, during which time around 20% of the community was affected. A multi-agency response was initiated immediately, overseen by the local Emergency Management Committee. The LEMCs are led by police and include community members and all key agencies responding to COVID, including the RFDS. The various agencies had prepared well for the outbreak. However, given the isolation and speed at which the outbreak took hold, it took 2 weeks to get all the elements of our surge response in place. Reynolds mentioned some of these already. Critical was the establishment of a field hospital managed by the RFDS, forming a COVID community response team in Wilcannia to look after cases isolating in the community, the ramping up of testing and vaccination services, provision of food and welfare support services, and access to sufficient alternate accommodation to assist with the isolation of cases and close contacts. As you would be aware, this wasn't readily available in the town prior to the outbreak. I'm pleased to report that the response went well. In particular, the community response was amazing and critical to limiting the spread of COVID. No one got seriously ill, which Randall mentioned, which is most unexpected based on experience, including Randall's, in the outbreak elsewhere. I think that was a real blessing. Major progress was also made with vaccination and achieved within 6 short weeks, thanks to the work of the RFDS, Marima and OSMAT. This is very important as it will protect community from future outbreaks as they occur. We're now in the recovery phase with services slowly returning to normal, but mindful that a resurgence could occur at any time, especially now New South Wales is open for business again. Thanks, Glenn.
Thank you, Professor Lyle. Appreciate those insights and thank you for sharing. A final question for the panel today goes to our General Manager Health Service, Jenny Beach. Jenny, we've heard reference today, very importantly, about the impact of COVID as it relates to mental health, not just to the community that we're servicing, but also, as importantly, to our staff and teams that have been working tirelessly through this entire pandemic. It's been an extremely busy time. How is your team holding up?
It has, Glenn, it has been very busy for a lot of people. I think there's a few things that here are really important. We've had lots of new people join the team, very connected with the brand, and I think that says a lot. That's been something that we've learned. Now, I've heard people from the very beginning, and I heard Belinda Gentle very early in the piece say, I love being able to go to these communities and vaccinate these people. And I think that says a lot about what drives people. I also think that the RFDS, their philosophy about engaging with communities, listening to what's needed, going to those people and doing it in the way that works in a really engaged fashion is really helpful. I think that's why it works well in communities. And then I think the other thing that's really important that we see over and over again, we hear people saying how much they have loved being part of this. The thing that I saw, and I would mention it particularly with Wilcannia, is our clinicians are often incredibly connected with these communities. So when those communities are hurting, so are the staff. And we have to remember that and support them all the way through. It's been an incredible effort, not only from, you know, the frontline people, but from all of the supporting organisations as well. And I think we've heard lots about that today, just how much it's been for people. So let's just remember that, and remember that with our colleagues and our partners when we're talking to them, that some people will, you know, have a high level of fatigue with this. Some people will have been challenged. And I think the social isolation that has gone with a lot of this is the other factor that's quite difficult. Our mental health team have had a big role in that and will continue to for quite a long time to come.
Thank you, Jenny. Appreciate that. And to all the panellists, thank you for your time today. Kellyanne, Belinda, Dr. Greenberg, Professor Lyle, thank you for your participation. Thank you for sharing those insightful insights and your experiences during the pandemic rollout. That is greatly appreciated. So to wrap up today, firstly, I'd like to thank everybody that's joined us today. Thank you for joining the Southeastern Section's Year in Review event, for taking time out of your schedules and sharing the highlights of the last 12 months with us, and hearing from our board president, Alex, our CEO, Greg, our patron, Her Excellency, the Honourable Margaret Beasley, our vaccine panellists and the rollout, and sharing some vision for that. And as part of the team, I'm incredibly proud of my colleagues and friends for the continued hard work and professionalism and dedication to the communities in which we serve. And in line with that, I'd really like to take the opportunity to personally echo the comments of Alex, Greg, and those that have shared their experiences today in thanking deeply all of our supporters. Without your continued support for the RFDS Southeast section, we just literally couldn't do what we love to do, and that's to support our communities. And we here at the Southeast section really hope that today's event's given you some greater insight into the fantastic work that's been done over the 12 months, not just delivering the traditional services across the communities which we are so proud of, but particularly through the challenges of COVID and its response. So to all of our supporters, thank you once again. We really look forward to staying engaged with you and keeping in touch for your support. And we hope you've gained a sense of pride for the difference you are making to the communities we serve and those people's lives. So before we wrap it up, what we have for you is a short video of some of our supporters and their contributions. We put that together, but before we sign off on the video, I'd like to thank you all. Please be well. Please stay safe as borders start to reopen and life goes back to the new normal. And we look forward to seeing you at the next event. We hope you enjoy this video. Thank you and goodbye.
I'm a regular giver of the RFDS. I've been doing it since I was 5. It's just something that I've always done and I always do. It's just like a habit at this point.
I support the RFDS by my involvement with the Outback Car Trek, the Royal Flying Doctor Outback Car Trek, which I've been doing for 30 years, so every one of them.
Well, it's a thing that I think will never change. It's just in our DNA that we're joined at the hip with the RFDS.
I support the Flying Doctors through cycling, doing cycling trips across the Outback and the hinterland.
Phoned up and I said, I think I can upgrade, so I upgraded to pilot wing member. And I said, do you want any volunteers? He said, how quick can you get it? And that was it.
I've been donating to it for a long time, and when I retired I decided I'd start to volunteer some speaking, which I still do for them now.
I give to the Royal Flying Doctor Service through financial contribution, as well as I've set a fundraising page for the Bondi to Bush Challenge.
The RFDS motivated me to get up every morning and actually do this ride for a good cause.
It's just amazing to be able to finish the challenge and stay fit and healthy, and also able to sort of give to the Royal Flying Doctor Service.
My twin sister and I rode from Nowra to Nymagee, and we raised in this COVID year about $3,500, which we thought was pretty good because it's very tough out there at the moment.
This is so worthwhile, and it combines raising money for a great cause and seeing the outback and becoming part of the family.
A person is serviced with some sort of medical service every 2 minutes of every day, of every month, of every year. And it's just, you know, the people in the bush couldn't live without.
When I hear of RFDS, it's just hope, knowing you've always got someone or something that can help you.
And to know that you can be safe anywhere you are.
When you get out there and see what can happen on a property or a car accident or something like that, the RFDS are just, you couldn't do without them.
I've seen the vastness in which the Australian communities are living, and it pretty much inspired me to say, hang on, this is a organisation you can support, and why not? And since then I haven't stopped. So 10 years on and it's still there.
Unfortunately, because of fundraising events such as ours, a great many fundraising events, that the RFDS is able to provide that mantle of safety.
If you're going to pick a charity, pick the Flying Doctors, because you know you're helping people right across Australia. And if we don't have those farmers and people on the land, then we're not a functioning society.
Yeah, I'm lucky enough to have a bit to spare. Like to do something good with it.